Here's a fact that might surprise you. 1 in 4 humans suffer from mental illness in their entire lifetime. Now, not because they do not want to seek help, it is just because there's a lot of myth around the same. So, on this World Mental Health Day, which is celebrated on October 10th, I'll be busting a few of the popular myths. The first being, mental illness is a sign of weakness, which is completely false. It's not a sign of weakness. It is just as common as diabetes, as common as any blood pressure issue. The mental illness are caused by genetics, then a lot of biochemistry, and our environmental or major life incidents. Second myth is, mental illness is only for the rich and the urban, and it's not for the people who live in the rural setup, which is completely false. Mental illness does not see that where you live, how much do you earn, what is your lifestyle. It is independent of all these factors. And yes, many people in the rural setup, they do have mental illness. It is just that they reach out to astrologers and faith healers, which in place worsens their illnesses. Third, mental illness is as common as you just need to think positive and you can snap out of it. Which is completely false. It is like asking a person with a fractured leg to run by thinking positive and having a strong willpower. Mental illness interferes with your brain chemistry, so it requires proper care and treatment. And yes, over the period, you can definitely get better and improve the quality of life. Next, coming to the myths around the psychiatric medications. A lot of patients come to us and their first concern is, since you're writing me medications, I am going to be there on them for lifetime and it's forever, which is completely false. Majority of the medications, antidepressants, anxiolytics, antipsychotics are given for few months. Indeed, there are certain disorders where we give for lifetime, but majority of them are treated within the course of months and eventually it is stopped. Please do not self-prescribe the medications. Next, psychiatric medications are addictive and they are sleeping pills, which is one of the biggest query I come across. And in fact, it's not true. Psychiatric medications, a majority of them, like I told you before, these are not addictive. They're only given for a few months and are carefully prescribed because it has a lot to do with your brain chemistry and it is eventually tapered and stopped. Now, coming to the next myth is, why do we need to taper? Some patients come to me and they say, since I'm getting better, I'll stop them. But the thing with the psychiatric medications is, they need a softer landing. When I say softer landing, it should not be abruptly stopped and without consulting your psychiatrist. It's like you are driving a car at 100 km/h speed, and if you want to reduce the speed, you don't apply your handbrakes. You slow down the speed gradually and then you stop. And then coming to the one of the most common is, the people who have psychiatric issues, they cannot function properly, they cannot live like normal lives. Now, with a proper care and a proper treatment, they do thrive in their lives. They function as normal as anybody else. Thank you.